Hello, my name is Daisy Reyes, and I'm going to be doing a presentation on mid-level providers. The roles of healthcare are expanding. In today's medical world, you are more likely to meet with a mid-level provider instead of a doctor. Mid-level providers have increasingly become a bigger part of hospitals and hospital-based clinics. What is a mid-level provider? It is a healthcare provider who has received different training and has a more restricted scope of practice than physicians, but they have a formal certificate and accreditation through licensing bodies. Mid-level providers include but are not limited to physician assistants or PAs, nurse practitioners or NPs, and midwives. A physician assistant is a medical professional who operates directly under the supervision of a doctor. PAs are able to examine, diagnose, and treat patients. Nurse practitioners are a subset of a group of nurses called Advanced Practice Registered Nurses. This can be a cardiology nurse that works specifically with cardiac patients. NPs can prescribe medication, examine patients, diagnose illnesses, and provide treatment, much like physicians do. A midwife is also a mid-level provider who provides prenatal care to expectant mothers. They care for infants during birth and assist a mother and her infant during postpartum. Now, you may be wondering how a doctor differs from a mid-level provider. A doctor and a mid-level provider differ in their level of education, job functions, and salaries. To become a doctor, it takes 4 years to obtain an undergraduate degree to get into medical school, another 2 years to obtain a medical degree, and then 3 to 7 additional years of residency training before they are allowed to obtain a license to practice medicine or surgery. It takes less time to become a mid-level provider. For example, a PA requires a 4-year undergraduate degree and a completion of an accredited physician assistant program, which generally takes about 25 months. To obtain a PA license, they have to complete a 1-year clinical rotation. The scope of a PA's duties include examining the patients, diagnosing illnesses, taking the patient's history, and developing and carrying out the treatment plans. The main job functions of a PA do overlap with that of a doctor across several aspects, except for a few major procedures, such as surgery. Doctors and PAs' salaries also vary widely. The average doctor's salary can range from about $200,000 to $300,000 a year. The average salary for a PA can range from about $86,000 to more than $100,000 a year. But what about complementary and alternative providers? Complementary and alternative medicine, also known as CAM, is a group of diverse medical and healthcare systems, practices, and products that are not part of conventional medicine. They include things like acupuncture, homeopathy, chiropractic and osteopathic medicine, and herbal medicine. A patient who has already tried Western medicine often seek an alternative medicine. Mid-level providers like chiropractors have to get the doctors to refer patients to them. Doctors may refer their toughest cases to CAMP providers. The reason they agree to refer those patients is because CAMP providers often offer the methods that doctors can't use. That concludes my presentation. These are the references that I used.